and welcome to the Business Spotlight. I'm your host, Patrick Dewar. Today I've got a great show. We're going to talk with a frequent guest, and that would be Dr. Mary Swift. She's the 2011-2012 Consumer Choice Award winner for cosmetic dentistry. We're going to talk about something that you hear a fair amount in the ads on teeth whitening, but they have a unique twist. They have a way of literally creating a life of brightness in your smile, and so you're really going to enjoy this show. Thank you so much, Dr. Mary.
Hi, Patrick.
It's always good to have you on the show.
Good to see you.
I love this topic because I went to your office and we actually went through that process, and I went from something that was close to dingy to a lot brighter. It's your fault.
So much fun. It's so much fun. It's the most frequently asked for procedure in dentistry today.
Is that right?
As our smile ages, it yellows. And so taking your teeth up 5 or 6 shades in one hour, basically, I mean, you just feel brighter inside and out.
One of the things that I was really surprised about, because before the show I was talking to your husband, and he was talking about those the strips. Some people try to use those strips. Now, he said you would have to use those for like every day for a year to equate to one session of your 1 hour experience. Is that about right?
Well, everybody whitens at a different pace. But if you review the ways you can whiten your teeth, there's everything from over-the-counter strips that you buy, take-home methods, and in-office methods.
Right.
Obviously, the least expensive, most available to the public are the strips, but they are not allowed to have the strength in the formula that we can do in the dental office.
Right. But then you guys have a method, like what you did for me was something that was very quick.
We used a laser on you.
Now, tell me about that. Like when you think about, I never saw any lights,
Yes.
but yet there was a treatment that you went through.
Yes. Laser whitening is the use of a laser beam to activate the molecules in the whitening agent, make them move quicker, and react on the tooth surface faster. There's another very popular, well-marketed method that requires actually a light that sits outside your mouth. That's not a laser. The laser would be the little wand that goes close to the teeth.
Right.
And there's actually some peripheral damage to skins if women use it. It's like a, yeah, I mean, I say that. I have heard. I have not seen firsthand. I think it's, but I've heard if a female patient uses any retinol products, which almost all of us do, or males, that is one contraindication. In other words, you shouldn't use an outside light source. So what the laser does is it allows us to get that activation closer to the tooth with big results.
Now, you guys have been doing this technology for a while, haven't you?
Yes, 10 plus years.
10 plus years. And I know that you've been one of these people that's always embraced technology at a rapid pace. You were way ahead of the game on a lot of that stuff. Was this something like that? For you, was it you were kind of cutting edge, even bleeding edge, so to speak?
With a laser, no bleeding.
See?
Which is the beauty of it. And in cosmetic dentistry, especially, you're looking at not just the teeth, but the gum line. And there has to be formulas and symmetry to assist us with beauty. And if you use a scalpel to create the gum contours, there is a healing process that the tissues will shrink back before they get where you want. With a laser, because you melt instead of cut, everything stays put. So it allows me to sculpt a gum line at the same time I sculpt a smile with porcelain. So
you're saying that your laser actually helps to create a better gum line as well?
Yes.
And it kind of seals it in place is what I'm hearing. That's what I heard. Is that what you said?
Thank you.
I
to talking, and I don't know if I hope everyone understands.
You want to make sure that people are getting it, but I'm still going, well,
Well, and so that same laser is the laser we use in whitening with a different attachment to it. So lasers have been very valuable in my practice.
And is that something that you manually or program when you're using it?
Both. You have some sets, but you titrate it based, ambient light, other factors. Yeah.
For all those chemistry majors out there,
they're going to love it. They would love the science of whitening.
I'll bet there's
and its origin is quite interesting.
In the next section, I want to actually get into the origin of it. And one thing that if somebody's catching the show and they're catching either the first segment or whatever, are there people that shouldn't do whitening?
Yeah. Do you want to get to that now or when we get back?
We've got about
people that don't have healthy teeth.
People that don't have healthy teeth.
Yes.
Okay.
You need health before beauty. So you never want to apply whitening agents to unhealthy surfaces.
Oh, okay. Well, I know as we get into the next few segments, and folks, if you're listening to us in the DFW area or Houston area, thank you so much. I hope that you go to the Dallas Dentistry.us site and visit Dr. Mary there. Or the other thing is, go like her on Facebook. You'll find her in Dallas Laser Dentistry there as well. And with that, I know we'll be right back after these messages. Thanks again. More of the Business Spotlight. And welcome back to the Business Spotlight. I'm Patrick Dewar. My guest today is Dr. Mary Swift. She is a dentist in the Dallas area. Dallas Dentistry.us is her website. She's the 2011-2012 Consumer Choice Award winner for cosmetic dentistry. Dr. Mary, thank you. Thank you so much for doing this.
Oh, my pleasure.
And we're talking today about teeth whitening. Who needs it?
My favorite topic.
Oh, good.
Well, need, that's it's mostly want, not need for whitening. It's the most asked for procedure in dentistry, in all of dentistry. And there's some misinformation out there. And so it's I think this is an opportunity to help clear some of that up. And good. I'd say one of the biggest questions, most frequently asked questions I get is it safe?
Right.
And I always like to tell the patient the origin of tooth whitening.
Yeah, that's what we're hoping to go into.
Yes, and it started with gum and bone research for health of gum. And there was a doctor almost 50 years ago that took hydrogen peroxide and baking soda and had his gum patients brush with that. And not only did their gums improve, but their teeth whitened. And
nice.
we figured out it was the hydrogen peroxide, and that was the beginning. That was the birth of whitening.
Was it the beginning of toothpaste as well?
No. We've had toothpaste, but the hydrogen peroxide, and so nowadays we use a formulation of that called carbamide peroxide, and the whitening agents obviously have developed every year since its birth. So yes, it's safe. It came from ways to help improve oral health. And actually still today when we whiten somebody, their gum tissues improve.
Do you start with that procedure and with a lot of people after they do their initial assessment and stuff like that? But I know that it leads into, like with, you've said things like veneers, you typically start with that, and then also with a lot of other procedures.
Anytime somebody comes in and says, Dr. Swift, I want a better smile.
Right.
We start breaking down what we can and can't do. Sometimes we can get there with whitening alone, okay? Sometimes it requires some porcelain. But we're going to match that porcelain to your other teeth. So almost everyone starts with some whitening so that the end product then everything's bright.
Now, I've heard some information about the whole teeth whitening procedure and how it affects someone's personality or psyche.
Well, we age by our teeth darkening as we age. That's part of the way a tooth ages. And so to reverse the aging process, taking that dark color out, it's the least expensive facelift you could ever get. And it does lift faces because everybody's looking in the rearview mirror, and I hear that all the time. On the way home, I kept looking in the rearview mirror. I couldn't believe it. Couldn't believe how white they were. So it brings smiles, and it then makes the patient want to do better keeping things clean too.
Well, the other thing, even with when I went through the procedure, the thing that I noticed is that beforehand, when I was talking to somebody, I would typically just allow my teeth, I'll say, to be covered.
Yeah.
But yet afterwards, I noticed that, I'd talk and there would be,
smile.
there was just it was an okay, because I knew that my teeth looked good.
Yeah. Oh, good. Yes,
I mean,
they
you can tell they look.
Oh, it does. It definitely has a lot to do with self-esteem. And we've even had situations where we've improved the patient's smile, but yet they were so much in the habit of guarding it that they almost had to learn how, teach them how to smile again without the hand going up or with, it takes a while,
I believe that. I believe that. Yeah. And then I know that even that a lot of times that once somebody can smile again, their attractor factor, so to speak, goes up, then they start feeling better. And I know you've even had stories where people started looking better.
Oh yeah,
they get
lost
raises.
Weight yeah, they get
like
raises.
That.
They lose weight. They find their spouse. Yes, good things happen. Good things happen when you smile more.
I completely get that. When we look at some of the current technology, you said, like when they went in and did my teeth, they had the what do you call it, the paste, or the blue stuff?
With the bleaching agent.
Yeah, the bleaching agent.
That was activated by the laser.
Right, okay. And then they removed that, and then they went in and we put some trays in for a while.
A recovery gel. We, one of the maybe complications with tooth whitening is sensitivity. And we have ways to deal with it, and I think that separates us from a lot of offices. So when we get back, let's talk about what we do in my practice to
Well, I would like
safety.
That, because the thing, I was surprised for the first few days afterwards, I would say something, and it would be, and it'd be like this.
My daughter called it lightning bolts in your teeth, and I thought that was a perfect description of it. It has to do with the tooth rehydrating. During the bleaching, we're dehydrating. But there's things you can do to help the patient.
I just remember it was a little bit like somebody taking a tuning fork.
Oh. Was it worth it?
Yeah, because it was so. I mean, it was so minor. This is a business spotlight. And Dr. Mary Swift is the 2011-2012 Consumer Choice Award winner for cosmetic dentistry. Fabulous show. We've got a couple more sections where we're going to show you more about keeping your smile on. We'll be right back. And welcome back to the Business Spotlight. I'm your host, Patrick Dewar. Today, we're visiting with Dr. Mary Swift of Dallas Cosmetic Dentist.us, and she's a Dallas dentist that has won both years for 2011 and 2012 Consumer Choice Award winner for cosmetic dentistry. Thank you so much.
Yes, thank you.
We were talking about the sensitivity issue.
The sensitivity issue.
I know that when I did it, it was just a couple of days afterwards. Every once in a while, it was like a breath of you call it lightning, I call it like cold air.
Yeah.
Hit one tooth.
Yeah. And right before the break, I was starting to explain it has to do with the dehydration that the tooth goes through when we whiten, and the tooth will rehydrate. It'll go away. Sometimes you think it's not going to. A little Tylenol, a little Advil takes care of it. Everybody's different. Some patients don't feel a thing. Others, it's significant, and we have to plan for it, and we do, with either over-the-counter or a little help getting through maybe just a 24-hour period with your whitening. And like I said, everybody's different. Not everybody even feels it. But there's also some little gels and ointments that we give the patient to help the tooth recuperate too. So I've never had anybody say that the discomfort was would prohibit them from doing it again. It's not that bad.
Absolutely. I completely recommend it. I was really blown away at how easy it was, how fast it was.
Yes.
And then all of the ways that you guys kind of keep you bright. Yeah. Because the things that I like coffee too much. Okay, I like, So I've heard, hey man, that can mess you up.
Well, no, in teeth there are two kinds of stains: the kind that's on top of your tooth and the kind that's deep inside. So the ones that are on top of your tooth, if you get your teeth cleaned regularly by a dentist or a hygienist, you can keep that under control. The kind that's in deep has to do with the same reason your hair is the color it is, or your eyes are the color. It's you. It's part of your DNA. But so that's where the whitening comes in. The bleaches, the whitening agents actually reach inside the tooth and bleach it from the inside out. So you really still can have a glass of wine and drink your coffee and just know that we have ways of keeping them white. So enjoy your
just
coffee.
Just go do it anyways, but make sure you schedule the follow-up.
Yes.
It's funny because I think it was almost 6 months ago that I went through your program, and I've been so pleased. And I just want to encourage people to really check it out. Go to our Facebook page. I know that's the Dallas Laser Dentistry. Oh, they put it up there. Dallas Laser Dentistry. To like that so that you can keep up with what's going on in dentistry. And I know that as we go into this last segment after this, I want to talk a little bit, maybe we got a little bit of time here, to talk about the new things coming. Are there things coming in whitening?
Yeah. In whitening, yeah. Mostly that's product development. As we watch chemically what the effect the whitening has on the surface of the tooth, the products can be modified and ingredients added to help hold down the sensitivity and increase the efficacy, make it stronger but more comfortable.
So there's always going to be a new improved
and improved. Oh, like always, yes. And it's come a long way. I mean, I remember my first bleaching agent that I ever saw in my practice was a real runny liquid, and it was a mess. Now it's just light years ahead of where it was, and that was 15 years ago. Was probably the first real office use of whitening products.
Really?
Yeah.
One of the things though about your practice in particular that I was so stunned with, and I think even the owner of UAN was saying, it's like a spa. I mean, you go in there and it's so easy, it's so comfortable, and people really, they start to calm down probably about the time they walk through the door, don't they?
Oh, well, not always, but but we're good with those people. I am fortunate enough to have an ACE team in place. I have the best group of, you went through it. They from start to finish. I think the biggest difference is we know who you are.
Right.
I walk into my doctor's office and I don't get the idea that they know who I am from the next person, but we know our patients, and they feel that.
There is something else though that I just learned about. I've never heard of a dentist doing this, and I love it. And that is that, how some offices they'll penalize you if you cancel within 24 hours. And what I understood was that you thought that was a little bit one-sided. That you want to make sure that people,
you
guys respect their time, and you really get people in right away,
try.
and even to the point that if they're delayed, there's a benefit for them.
Yes, absolutely. We respect your time. We'll do everything we can to seat you. You know, there are emergencies that happen that might run you late, but even if you're running a little bit late, you keep the patient informed. You don't let them sit there. There's things we do. We're going to respect your time.
That's awesome.
Yeah,
that is so good. Well, again, we're talking with Dr. Mary Swift. She's the 2011 and the 2012 Consumer Choice Award winner for cosmetic dentistry. This is Pat Dewar. We've got one more section coming up of the Business Spotlight. We'll be right back.
What do we need to wrap up?
And welcome back to the Business Spotlight. Today we're talking with Dr. Mary Swift. She's the 2011, 2012, and that's 2 years, that she was the Consumer Choice Award winner for cosmetic dentistry in the Dallas area. That's a pretty high honor, seeing as how they don't usually give that out very often. And one of the things that we've been talking about is teeth whitening. You've probably seen a million ads on teeth whitening, and it's everything from, I don't know, whatever the technologies are. The good news here is that I've actually been to Dr. Mary's office, had your laser whitening, and was blown away at not only the effectiveness of your team and like we were talking about before, the atmosphere that you portray, but then even beyond that, how fast it was like 1 hour, and I was in and out, and I had my work done, and then they coached me, so to speak, on what to do next and how to make sure that you keep raising it up so that you don't quite ever, maybe you never get to quite what veneers are, but you raise it up a lot. As we look forward to, this segment, I want people to connect to you. What's the experience when they do? I know mine was amazing. What do you tell everybody that they would expect if they were interested in whitening or really anything? I guess.
Well, first off, we will do a consultation, no charge.
Very good.
And I love giving second opinions. You should expect for me to know what you're in there for the first time you're in there.
Right.
We're going to address your chief concern. We're going to look at everything and make all our recommendations. But if you want whitening and you love your dentist and that's all you want, we'll accommodate.
Right.
Absolutely.
Right. But then even beyond that, if you can earn their business, of course you want that. But if they do, what's the general process that you guys run through?
Always health first. We are a cosmetic driven practice, and we love creating beautiful smiles, but beauty has to start with health, so you'll get a thorough exam. It's like the road map. You wouldn't take off for a big long road trip without knowing where you're going. And we plan the same way. We'll maximize your benefits. We'll consider your place in the world. Is it time now to do this or not? And we'll give you choices. We will develop a plan based on your needs and your requests, and then we'll hopefully show you ways we can make it happen.
Now, the couple of interesting things there is you mentioned that you maximize their benefits with their insurance, if they've got that. You'll also put together a plan, and the plan keeps in mind their...
Oh, there have been many times where if people are missing teeth, and you should always replace a missing teeth. It's like a domino effect. Everything collapses from there. But it's overwhelming to look at, I've got to do all this in this year, this calendar year, and my benefits only cover this much.
Exactly.
And my dentist is telling me I better do it all. Well, you know what? I'm not opposed to, let's do this one this year. Let's do that one the next year. Let's form a relationship. Let's get, to know each other and develop a plan for a long-term relationship, not just to fix it this year.
And you have clients that go back a while. I mean, you've
yes.
I know that you've been a dentist for, a few years.
17 years. Mm-hmm.
And
I was
so
a hygienist before that.
Wow.
And a dental assistant before that. And I actually have a family that was a patient of mine when I was a hygienist before I even went to dental school, waited for me to get out, and then found me with a name change, and are patients today.
Nice.
Isn't that
nice.
sweet?
That's really great. So you probably have done at least parents and some kids.
Oh, yeah. Oh, yeah. Oh,
That's
yeah.
awesome.
Families, and then we start to see who all they work with, because then we see all their work people, because they know that, they can come there and have their benefits, respected.
Do you work with businesses much? I mean,
it just happens that way. You seem to, if you get somebody that's got a good working relationship with their colleagues, then they say, do you know a good dentist? And then we start, like I said, seeing the whole office.
That's
and
really
seeing
good.
the whole family.
I so encourage, if you're a business owner, develop a relationship with Dr. Mary, because I know that even the last dentist that I worked with years ago, I met them because of a relationship they had with the HR lady. And so it was just a kind of just sprung out of that, and I think, wow, what a great benefit. Isn't just, hey, go out there, find somebody. It's
No, we've had that. We've had a HR person direct many to our, grateful for those.
As we're moving into the closing moments here, I really want to look at what else would you like to tell any audience right now? Somebody is thinking about coming to see you.
That the I don't have insurance is a reason to stay away. A lot of times, if that's the philosophy, then what you have out of pocket is more than, even with insurance, than it would have been if you'd have taken care of it early. Example, you need a filling. You're not going to get the filling done because you don't have insurance yet. Waiting for those benefits, the issue gets bigger, and then you need a crown. So where you would have had to pay $50 out of pocket after your insurance for the filling, now you got to pay hundreds out of pocket after insurance for a crown. So I know it's natural human tendency to stay away, but preventive care is.
So what I'm hearing is, don't use that excuse.
Wait.
Don't use that excuse. Come, you guys have programs.
We'll help.
This is the Business Spotlight, and as we're wrapping today up, I just want to say thanks for watching. Like the Facebook for Dallas Laser Dentistry, Dentist, and this is Pat Dewar. We'll see you next time. Have a great week.